The experts that care for you at Des Moines University Clinic are more than just clinicians. They're researchers, teachers, and mentors who are training tomorrow's healthcare professionals. Call today or visit dmu.edu/clinic.
Hello, my name is Dr. Kathy Fresh, and I work at Des Moines University as an associate professor in the College of Pediatric Medicine and Surgery. There I teach students as well as treat patients. Over the years, my clinical practice has more gone on the way of wound care and taking care of people with chronic wounds and wound care management. So I'd like to talk to you about the different types of wounds that can happen as you get older and how you can take care of it and when to go to the doctor. So throughout this presentation, I will be using the words ulcer and wounds interchangeably. So what is an ulcer? Basically, it's just an open sore that's caused by a break in the skin that doesn't heal within the 1 to 2 week time period that you would expect it to heal in. And just FYI, I have a lot of pictures in here that show different wounds, and so if you are sensitive to that, you may not want to look at all of the different things. But next, I'm going to talk about the different ulcer types. There's a lot of different things that can cause wounds and keep them from healing, and sometimes people can have more than one thing going on at a time, making things a little bit more complex. So we'll talk about arterial, venous, traumatic, neuropathic, and pressure ulcers. So I'd like to kind of talk about the difference between veins versus arteries because people sometimes don't always understand the difference. Veins carry blood back to the heart. They must go up against gravity. They have a little bit of a thinner vessel wall, and because they're going up against gravity, they have valves that are present, so that way the blood doesn't flow back downhill, so to speak. Sometimes over time those valves can get damaged, and so the blood leaks back down, causing a lot of swelling within the leg. Then the fluid and the blood leaks out, causing damage to the skin, which can lead to wounds. Also, if patients can't walk as well due to mobility issues, this can cause some swelling issues as well because you need your muscles to help with the veins with this. Arteries are what carry the blood from the heart and lungs down to your foot, and so it carries oxygenated blood. You have thicker vessel wall, no valves, and so if you have a blockage in the artery, you're not getting enough oxygen to the foot or leg, and so this can lead to wound healing problems versus with the veins. Usually they don't have blockages, but the veins don't work properly to where all the fluid goes against gravity and you cause more swelling. So this is kind of just showing how the calf pump helps. So when you're walking around or moving your muscles, the muscles squeeze those veins and then will help to get the blood moving in the right direction. Just take a look at the arterial ulcers. They are very characteristic. Typically, they will either be black or yellow. They won't have a nice pink healthy base, and this is due to lack of oxygen. As long as you still have good feeling in your feet, these wounds have a tendency to be very painful. And with people who have severe blockages within their arteries, they tend to be more painful when the leg is elevated, and so that's a big key that you might have an arterial issue. If you're getting a wound that's looking at like this, then you definitely want to go to your doctor and see if you can get tested to make sure you're getting enough blood flow to the foot, because there are procedures that can be done to open it up. These type of ulcers have higher risk of further wound complications and sometimes can lead to amputation. So treatment, biggest thing, vascular testing, to where they can do some basic tests to see if you're getting circulation. You may need to have an angiogram where they make a little small incision up into the groin and inject dye to look at the arteries. Then the vascular surgeons can see where there is blockage, and if there's a blockage, they can put a stent like they would do for your heart or a balloon to open things up. If you have a wound like this, usually I want to try to keep it as dry as possible just because the body doesn't have enough circulation to heal it, and the tissue essentially is dying off. And so we want to keep it dry so that way it doesn't get too moist, because if it gets too moist, then bacteria can get in and that can make you sick and lead to further amputation. So usually I recommend betadine and trying to keep these wounds dry and not soaking the foot. Another product that I use a lot is something called Iodosorb, which is an iodine gel. Kind of good for those yellow wounds to help maintain a moisture balance. And you can find that on Amazon for about $20 to $40 a tube. Venous ulcers are usually in a different location and have a different appearance. They're generally up around the ankle or the calf. And again, this is because the valves aren't working. You're getting a lot of extra swelling within the legs. You may see varicose veins with these. These also can be painful as well, but usually not quite as painful as the arterial ulcers. Also, you might start to see brown staining of your skin, and that's just because the red blood cells are leaking out and breaking open, causing staining to occur. The biggest thing with this, because you are getting that extra swelling and the veins aren't working properly, compression is key, and you need to have compression all the way from the toes all the way up to the knee. And this is a big question I get from people, particularly if they have a smaller wound caused by the varicose veins and venous stasis ulcers. Why, if I have a small wound, do I have to wrap the whole leg? And it has to do with just getting all the fluid up and going back up into your body and going out through your kidneys and urinating it out versus it hanging out in your leg and linking out these wounds, because the fluid is going to want to go out the path of least resistance, and compression has been shown to be the #1 way to get it to heal. Also, just elevating your legs can help to get the swelling down. Sometimes you may need to see your primary care doctor and have an increase in your diuretics or your water pills. And sometimes we'll send you to see a vascular surgeon to where they can do some things with the veins as well to kind of redirect the flow. Once things healed, then usually we like to keep you in long-term compression, just so that way we don't get a whole bunch of extra fluid down on the legs, because then the skin can break back open, blister, and that fluid will want to come out. And so either with compression socks, which I know are hard to get on and off for a lot of people, particularly as they're aged due to hand strength or lack of mobility. So sometimes I'll use products such as edema wear, which is the bottom one, or Tubigrip or Surgigrip, which is the top one. The edema wear is kind of like a heavy-duty fishnet stocking. It's a little easier to get on and off than the compression socks. Or you can get the Tubigrip as a big roll, and you can just cut it off from the roll, and those are usually pretty easy to get on and off. You can also use A-straps as well. But again, you want to kind of go all the way from the toes to the knees so you have nice, even compression, and it's not digging into the leg. Sometimes you can get ulcers due to trauma, and it can just be minor trauma, particularly because skin gets a little bit thinner as people age, and sometimes with certain medications such as steroids can cause skin to thin. Also, a lot of people who are older are on blood thinners, and so even a minor trauma can cause some bleeding underneath the skin and cause a hematoma. As you see in this picture here, the patient originally had a little bit of a skin tear and the hematoma, it was stitched, and then that skin all dies just from having all that extra blood sitting underneath the skin, and so you end up with a sore. Other things that might contribute: if you have heart, lung, liver, kidney disease, so you have a lot of extra fluid just because your body isn't processing it well, and all that fluid ends up in the legs. So again, compression will help with healing on these types of wounds. Neuropathic is generally due to diabetes, where people have lost sensation in their feet, but not always. Sometimes just with age, people can start to lose feeling in their feet, or if they've had problems with back issues where they have bulging discs or stenosis, can cause neuropathy within the feet. Usually with these are going to be on the bottom of the foot, where people might be getting high pressure areas and callousing. And when you lose sensation in your feet, the calluses start to build up and build up and build up, and you don't change the way you walk because you don't feel it. And then eventually the callus will thicken up so much that the tissue underneath breaks down, and then you end up with a sore. Biggest places I see it are underneath the big toe joint, where you see like on the toe itself, and then underneath the ball of the foot on the outside part of the foot. Sometimes you'll see staining of the callus, like you see in this picture here, where you're getting microbleeding within that callus tissue. And it's not painful because the person has lost sensation in their feet. And a lot of it can be due to foot deformities that happen over time, where Again, you just have these high pressure areas, maybe due to curling of the toes or a hammer toe. The callus builds up and then the skin breaks down, like you can see in this picture. Other foot deformities, bunion, as you can see on the left. The one from the second from the left, they're walking more on the outside of the foot. Again, hammer toes can push the toes down, or you might have a flat foot. So the biggest thing is just trying to get pressure relief, trying not to go barefoot or sock-footed, wearing good supportive shoes or sandals. Debridement, that just means coming into the clinic and not doing it yourself. We don't want people doing their own bathroom surgery. Where we trim down all that extra callus because it helps to relieve some of that pressure. Sometimes we might put you in a cast or shoe for a while. And then if you're diabetic, trying to keep your blood sugars under good control. And then the final ulcer category is pressure ulcers. And this is usually due to people who are wheelchair bound or been hospitalized recently or were in bed for a while. The biggest place where I see it is on the back of the heel, particularly if they've been lying in bed and not moving. And so heel protector boot, like you can see up the top, is very helpful. Sometimes you can see them on the front of the ankle, as you can see there, where people were getting wrapped and the wraps got a little bit too tight. Other reasons why you might see ulcers due to pressure is if people are sitting in their wheelchair, they have hard wheelchair rests, and their foot is just sitting in one position all day long, and that can cause increased pressure. The biggest thing, again, is just pressure relief. Sometimes using pillows or other padding while the patient is laying in bed or sitting in the recliner, so that way they're not having that pressure on the one spot all day long. And who is at risk? Kind of what we've already talked about. Other things I'd like to kind of point out is that people who smoke or use nicotine products. Nicotine causes constriction of your arteries, so that way you're not getting as much blood flow, and also reduces the oxygen to the feet, and so has been shown to cause wound healing. We already kind of talked about the other things such as neuropathy, diabetes, varicose vein swelling, but diet can play a big issue too, just because you need a lot of extra protein to help heal wounds once you get them. Diabetes, blood glucose goals, want to keep your blood sugar between 100 and 120 if you can. Anything higher than that can lead to wound healing problems. It's been shown that the hemoglobin A1C, the long-term marker, for every 1% increase above 7%, wound healing decreases dramatically. And so if your blood sugars are running that high, then it can lead to neuropathy or numbness within the feet. It can lead to arterial disease where you have blockages and lead to those arterial ulcers. And this is just showing the study where they had shown that wound healing rates really decrease once you get above 7% with your hemoglobin A1C. So nutrition plays a big part. Recently there was recommendations from the council that looks at pressure ulcers, but it can apply to all ulcers. They recommended that you need to have 1.2 to 1.5 grams per kilogram of body weight. So for those of us who are not as keen with the metric system, that is 0.6 to 0.68 grams per body weight. And so what that translates out to is a 150-pound person needs about 82 to 102 grams. A 200 person needs 108 to 135 grams. Some good protein choices are lean beef, chicken, fish. You can use dairy, nuts, beans. Those sort of things can all help. Or I encourage people to do protein shakes like Ensure or Boost, or Juven is one specifically for wound healing. It's a little bit expensive, but it's nice because you can mix it into water, and they do have a flavorless version that you can mix it into whatever drink that you have. So recommendations, make sure you check your feet daily if you are at risk. All diabetics should have a yearly foot exam. Those who are at risk, examine 1 to 6 months by a podiatrist or by your primary care physician. And kind of beware, just because you have a wound that doesn't hurt, that doesn't necessarily mean that that's a big thing. That might be, that might not mean that it's a good thing. That can mean that you have lost sensation in your feet, and if you have a wound for a long time and it doesn't hurt, then you probably need to be seen by somebody. Shoe gear, you need to make sure that something that's easy to get on and off and it's nice and stable, lightweight ideally, and make sure you have plenty of toe room. You don't want the toes squished together. And just because you were a size 7 when you're 20 years old doesn't mean that you still wear a size 7 when you're 60. As we age, the ligaments start to loosen, and that leads to a larger shoe size. And so you may need to be refitted as you grow older. And I know I myself has gone up a shoe size after I had my daughter. If you are diabetic and you have peripheral neuropathy or arterial disease, Medicare will pay for 1 pair of shoes per year. Kind of do's and don'ts. If you're at risk, check your feet daily. Don't use heating pads on your feet or legs, just because I've seen people who've ended up with burns, particularly people who are neuropathic. Make sure you check your water temperature. I've seen a lot of people who've gone to soak their feet and had the water too hot and end up with bad burns and led to amputations. Don't go barefoot or sock-footed around the house, particularly having neuropathy or arterial disease, because you don't know what you could step on that could cause problems. So at least wear slippers or sandals. Use lotion on your dry skin so they don't crack open, causing problems, but don't use in between the toes because it can get too moist in those areas, and you need to make sure you dry very well in between the toes due to that, because that can lead to sores. Don't use medicated corn removers if you're starting to get corns or calluses on the toes. Those corn removers contain acid, and sometimes it can eat away your good skin, leading to sores. Make sure you inspect your shoes before putting them on. Sometimes things can drop into your shoes. I did have a patient many years ago who accidentally had a set of keys dropped into his shoes. He didn't realize it, walked around all day with keys in his shoes because his neuropathy was that bad, and ended up with sores on his toes. Don't do your own bathroom surgery. Don't trim your own calluses. You can use a nail file or a pumice stone on it, but don't take anything sharp to it. Make sure you elevate your legs when sitting, particularly if you're getting swelling. That will help with your skin overall. And then I kind of put soaking feet ? Again, you can soak your feet, but make sure you check the water temperature. If you're using Epsom salt, it might feel nice. However, sometimes that can have a drying effect if you already have dry skin. Caring for wounds at home. So you can clean with just saline or soap and water daily. And it's okay to go ahead and get them wet and get them washed up. You don't need to use peroxide. Peroxide kills everything. It kills bacteria, but also kills the cells that are trying to form. And so I don't recommend just dumping a bunch of peroxide on your wounds due to that reason. Keep wounds covered with dry gauze or Band-Aid. If the skin is thin or sensitive, use paper tape and gauze instead of the Band-Aid, so that way you don't tear your skin. And the biggest thing that I also counsel people on is that wounds don't need air to heal, particularly on the lower extremity, on the feet and legs. Just because we're walking around, a lot of people end up getting pet hair in them, dirt, debris that lead to infection. Also, if you have a lot of swelling within the legs start to have a lot of extra fluid coming out of them. They need to be covered and have compression on there to get the fluid up and out through the kidneys and not through the legs. And so we do want to keep wounds covered. If swelling, definitely use your compression from toes to knee. Topically, I do recommend, from the store, either bacitracin or polysporin. You can use triple antibiotic ointment or Neosporin. However, sometimes people can develop a sensitivity to the third antibiotic in that particular ointment. So usually I recommend the bacitracin or the polysporin instead. Betadine is nice if you have a wound that you want to keep dry, like an arterial ulcer, or if you have a highly draining wound, it will dry things out for you. Online, you can purchase medical grade honey. The brand name is MediHoney, or the iodosorb that I mentioned earlier. Medical grade honey is a little bit different than your regular honey in that it is irradiated to kill any clostridial spores, and it's a little bit thicker. And honey has been shown to help with wound healing by decreasing bacteria and helping just with wound healing overall. When should you see a doctor? If the wound really hasn't shown signs of healing after 2 to 4 weeks. If you have any signs of infection, pain when you don't normally have pain, redness, odor, blood glucose is really hard to control, and then of course fever, chills, nausea, or vomiting. Or if the wound turns purple or black, that is a big sign that you need to get seen right away, because you might have decreased circulation and you're at risk of losing a toe or a limb. So I hope you enjoyed my presentation, and I'll welcome any questions that you guys have.
At Des Moines University Clinic, Foot and Ankle, our expert providers provide comprehensive care for older adults who often have compounded foot and ankle issues. The Foot and Ankle Clinic has the largest group of board-certified podiatric physicians in central Iowa. As a teaching clinic, we're training the next group of podiatric physicians, which means that our clinic offers the most advanced care in foot and ankle possible. Doctors of podiatric medicine are specialists in the diagnosis, treatment, and care of lower extremity disorders, diseases, and injuries. Our physicians diagnose and treat conditions such as ulcers, tumors, fractures, skin and nail diseases, injuries, as well as deformities and conditions such as weak feet and foot imbalances. We use innovative methods to treat many conditions such as ingrown toenails, calluses, fractures, other injuries, as well as arch problems and bone disorders. At Foot and Ankle, we offer thorough consultations for both preventative care as well as diagnosis and treatment of many conditions involving the foot and ankle. No matter what foot and ankle issue you're dealing with, know that a team of specialists here at Des Moines University Clinics is willing and ready to help with whatever needs you may have.